Is your life negatively impacted by bloating and gas and stomach pain and diarrhea or constipation or a combination of them? Have you seen a doctor and they've labeled you with IBS and sent you on your way? Just imagine a life where you understand what triggers your IBS and you avoid those things and you return to a quality of life that isn't built around being near somewhere that has a toilet, but is built around you doing what you want to do and not having to worry about where the closest restroom is. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. If you're suffering from IBS and you've done some research for yourself, you've probably tried avoiding gluten because you've heard gluten and wheat can be triggers of IBS. Well, if you've done that, then that's a good thing, and maybe you've sustained relief. Or maybe you've asked an allergist or your medical doctor whether or not you have a gluten allergy or gluten sensitivity. And you went to the doctor or the allergist and they ran an IgE skin prick test or some sort of serum test to say, do you have a gluten allergy or not? And that came back negative. So that doctor said, you do not have a gluten allergy, go ahead and eat gluten. This is a very common occurrence because in that world, all they're thinking about is either an IgE allergy or celiac disease. So you may have said, hey doc, do I have celiac disease? Because I know gluten triggers that. And then they may have run a colonoscopy to see if you have intestinal changes that are diagnostic of celiac disease. And they say, no, there's no diagnostic changes on imaging, so you do not have celiac disease. So you don't have to avoid the gluten. It's not driving your IBS. Well, that doctor may be right in that you may not have celiac disease that's driving your IBS, but they may be wrong in saying that you do not have a gluten sensitivity or a gluten response, because there are other issues with gluten besides celiac disease. There's non-celiac gluten sensitivity, there's non-IgE mediated gluten or wheat allergies, So there's multiple other things that could be going on with you. Now, up to 10% of the population is dealing with non-celiac gluten sensitivity. So that could be one thing that is causing you to respond to gluten, and one reason why you have realized, hey, if I avoid gluten, I do better. So you want to listen to yourself and your body as you're paying attention to things of this nature. Now, in the Western world, up to 13% of people avoid gluten. Research says that it's possible that if you are avoiding gluten because you've just noticed by experimentation, when I eat gluten, my symptoms are worse. When I avoid gluten, my symptoms are better. Well, up to 42% of those people may have celiac disease. So if you're a person who's never seen a doctor or been tested, but you say, hey, when I eat wheat or gluten, I have symptoms. When I avoid it, I don't, you may have celiac disease and should rule that out. But even in the absence of celiac disease, these people can have non-celiac gluten, non-celiac gluten sensitivity, or IgE, non-IgE mediated wheat allergy. What does that mean? Well, in the world of allergy and allergists, allergies are defined as having an IgE positive serum test against something, which indicates you're sensitized to it. And then when you challenge the person with the positive sensitivity, it results in acute symptoms. So it looks like this. we test you for a IgE serum wheat test, and you're positive. So you're positive for IgE against wheat, meaning there's the risk of allergy there. Well, it's not diagnosed as allergy until you have that positive marker in your blood, and then you go eat wheat and have immediate symptoms. Those could be GI symptoms or skin symptoms or respiratory symptoms or even anaphylaxis. So if you don't have both the positive IgE blood test and the response, then they're not going to say you have allergy. That's the technicalities or the semantics of allergy. But it doesn't mean you're not sensitive to it. And it doesn't mean that you're not even allergic to it. You could have a non-IgE mediated wheat allergy, meaning you're not going to have a positive IgE test, but you're going to have other immune cells such as eosinophils or mast cells that respond to the wheat and create symptoms in your body that could be GI or extraintestinal, brain fog, skin, etc. So remember, mast cells make histamine. So a mast cell response against wheat would be a high histamine response. Eosinophils are going to play into driving histamine, driving platelet activating factor, driving a pro-inflammatory response as well. So just because you don't have celiac disease on the diagnostic imaging or IgE positivity on the blood test doesn't mean that the doctor is right in saying that you don't have allergy. You may have an allergic response along another mechanism. So this is something important to know. The other mechanism could be antibodies against gliadin, which is a protein fraction of wheat that is typically not tested for in the allergist's office. So that's another mechanism to look for. Now, back to the IBS. Studies have shown that up to 36% of IBS patients have gluten-sensitive IBS. Well, how many people in the world is that? Up to 20% of the planet suffers with IBS. There's 6 billion people on the planet. 20% of 6 billion is 1.2 billion. 36% of 1.2 billion is 800 million. So up to 800 million people on the planet are dealing with IBS that is triggered by wheat in some form or another, wheat or gluten, some fraction of wheat, gluten, amylase tryptase inhibitors, wheat germ agglutinin, all the different factors of wheat that you can respond to. So just because 2 tests are negative doesn't mean you're not responding to wheat and that wheat is not driving your IBS. So let's make it practical. How do you figure it out? Well, one underlying theme in all of this is regardless of what's triggering your response to wheat, whether it's a wheat allergy or a non-IgE mediated wheat allergy or a non-celiac gluten sensitivity or a celiac disease or an amylase tryptase inhibitor sensitivity or an anti-gliadin antibody response or a wheat germ agglutinin response, a lectin response. Regardless of what it is, the answer is cut out wheat, okay? Avoid wheat, go on a gluten-free diet. You may also respond to FODMAPs. FODMAPs can drive IBS, and wheat has fructans in it, which is a FODMAP. That could be the wheat contribution to your IBS from a FODMAP perspective. So for a subset of wheat-induced IBS patients, it's coming from FODMAPs and fructans, and so a low FODMAP diet may improve the symptomatology for those patients. So the answer for you, if you have wheat-driven IBS, is going to be eliminating the wheat and the gluten, etc. That could look like a low FODMAP diet. That could look like a gluten-free diet. Studies show that low FODMAP diet results in between 56 and 74% improvement in IBS symptoms according to standardized outcome assessments. So that's a significant improvement if you avoid FODMAPs. But the low FODMAP diet could result in nutrient deficiencies in iron and calcium and others. So you want to work with a practitioner who is trained in implementing FODMAPs with you to do it correctly. Studies have shown that the gluten-free diet is easier for patients to implement and put you at less risk for nutrient deficiencies. So it's going to be more sustainable long term. So to wrap it up, if you are someone that suffers with the bloating, the stool abnormalities, whether it's diarrhea, constipation, or mixed, if you suffer with stomach pain after every time you eat, that's going to be IBS. That's up to 1.2 billion people on the planet. While 800 million of those people, or 1/3 of IBS sufferers, have wheat or gluten-driven IBS. And it may not be what the standard models used to looking for. So you may be told, hey, wheat or gluten aren't bothering you, so go ahead and eat them. That may not be true. They may have only looked at 2 pieces of the huge puzzle that could be involved. So ultimately, if you say, well, they say I don't have the wheat allergy, but whenever I consume wheat, I get symptoms, listen to your body and avoid the wheat, because one or more of these mechanisms is involved. So work with a practitioner that can help you with implementing a low FODMAP diet or a gluten-free diet, and teasing out the testing more specifically if you're interested in that, to determine what specifically is it, and definitely to rule out celiac disease.